We begin tonight with a rise of attacks on local healthcare workers. Spectrum Health officials say they are seeing more verbal and physical assaults on their doctors and nurses because of the pandemic. 13 on your side's Andrea Flores joins us now with details.
Juliet, Spectrum Health's chief medical officer, tells me that they're seeing one of the busiest weeks ever with nearly 200 COVID-19 patients in the hospital right now. And now more than ever, they're encouraging patients to prioritize everyone's health.
We've noticed about a threefold increase in kind of violent or threatening behaviors.
Spectrum Health is linking spikes in violence against its healthcare workers to COVID-19 cases in West Michigan.
As the number of COVID infections increase throughout the community, and we have to impose some further restrictions such as visitor restrictions or masking requirements, the number of incidents does seem to correlate with those surges.
Before the pandemic, the hospital system saw about 100 physical and verbal assaults per month, and now the monthly average is up to 300.
So it can range from anything from a patient or a family member being belligerent with us about a masking requirement to a full-on violent physical assault against our staff. Sometimes unfortunately, our staff are spit on, kicked, bit.
Chief Medical Officer Dr. Joshua Koistra says some of the incidents are out of the patient's control because of their health, but there's also bad intentions because of polarizing opinions during the pandemic.
When people's viewpoints or opinions are so entrenched in who they are, and those are challenged, I think people come out more aggressively than they typically would.
Doctors, nurses, and staff are doing de-escalation training to help, and a safety alert button has been added to their badge to call security when needed.
When you are placed in those situations, your level of anxiety rises to the point that you know you're not delivering as good of care as you can.
Dr. Koistra hopes everyone remembers that's what hospital workers are there for, to take care of everyone.
Trying to be argumentative or disruptive with that person really does no good except prevent you or hinder you from getting the best care that you could. And so I would just ask people to have grace with our healthcare team.
There are many hospitals across the country that have given panic buttons to their staff like Spectrum in response to increased attacks. Now, a recent study from the National Nurses United found more than 30% of hospital nurses have experienced violence at work, up 10% from this past spring. Juliet?